I would like to say hello to everybody, ladies and gentlemen. Welcome down, and thank you for joining us at our very, very special Singapore Heart Foundation Health Talk. And my name is Samson Z, your host for today. Now, today's session, ladies and gentlemen, is a very special session because this session focuses on the interrelationship between obesity, heart disease, and diabetes. Now, we invited a panel of experts or speakers in the field of cardiology and endocrinology to share about how obesity increases risk of diabetes and how it can affect heart health as well. So with us, ladies and gentlemen, we have professionals with us. But before that, here's some facts for you. Now, ladies and gentlemen, did you know that obesity is fast becoming a serious health challenge in Singapore? Now, the condition accounts for 8.9% of Singaporeans adults aged 18 to 59 and 6.9% of those aged 60 to 74. Now, however, obesity has the highest prevalence among children and teens aged 6 to 18. And in this age group, obesity accounts for a whopping 13%, almost double of those aged 60 to 74. Now, obesity also increases the risk of heart attack by 3 times and diabetes by 80 times. Therefore, it is important to act against obesity to lower our risk of CVD, diabetes, and other heart health challenges that may follow. And today, here are our panel. And our panelists includes of Associate Professor Jack Tan. Hi, Jack Tan. He's a Deputy Head and Senior Consultant, Department of Cardiology, National Heart Centre, Singapore. Also the President, Asian Pacific Society of Cardiology and International Society of Cardiovascular Pharmacotherapy. And also we have Dr. Tam Kwang Wei, Senior Consultant Endocrinologist, President, Singapore Association for the Study of Obesity, and Dr. Natalie Koh, Consultant, Department of Cardiology, National Heart Centre, Singapore. So right now, folks, let's dive into understanding obesity and its relation to diabetes and heart diseases. First question to Dr. Tam, what is obesity?
Thanks for having me for the forum. Firstly, obesity is a medical condition. I think it's more than just looks. I just want to really clarify that. And it's actually a chronic medical condition resulting from actually imbalance of what we call energy homeostasis. And then results in either excessive fat accumulation or fat accumulating the wrong places, then results in health problems. So in a nutshell, this is what obesity is. And it tends to be relapsing and progressive. It's not something that came on over 3 months, and it's not something we can deal with in 3 months because of its chronicity.
Now, how do you determine if a person has obesity?
Sure, I guess, so excessive fat or abnormal fat distribution. So excessive means if the weight is excessive for the height. So we use this thing called a body mass index. So we use our weight and then divide it by our height twice. So it's called, so in kgs and meters squared. So if you know your weight in kilograms, just punch it in the calculator, then divide that by your height in meters, like I'm 1.58, and you divide by 1.58 again. And I think you have a calculator, I think on the hearthealth.com, and even in our website, which we'll share later on, there's some calculators that you can use. Now, in Asia, we use a BMI of 23 and above to be overweight and obese, and 27.5 to be obese. Now, another way to know if we are overweight or obese is to use the waist circumference. Now, that's where weight is accumulating in the wrong areas, right? So someone may think they're not so overweight or may not be so overweight on a BMI, but if the fat accumulates in the waist circumference for women, in Asian women, we can't have a midriff of more than 80 centimeters, and for men, not more than 90 centimeters. Midriff means it's near your belly button, about there. If you don't know, just go to the doctor. If you really want to do it on your own, just near the belly button or the largest part of your bulge, if we have one, hopefully not. And then that's your waist circumference. And if that exceeds this markers, then again, one is at risk for example, heart disease, type 2 diabetes, and a whole host of other problems. And that's how we measure excessive or abnormal fat accumulation.
Very interesting facts there. Now, can we tell just by looking, like, for example, if I'm skinny, how do I know I'm actually obese?
Right. Okay, this is just for description. It's not to discriminate anybody here. So since the question was asked, is that it's a little bit like some people who have apple on sticks, right? For example, so they have a rather very endowed, I would say, at the mid part of the body. And then they may look quite thin on the arms and the legs, for example. So this is people who do have then maybe excessive abdominal fat, but are quite lean in the body mass. So sarcopenia is one thing, or some people have an apple shape. Actually, that's more favorable. So they may not look so bulgy in the middle, but maybe at the bottom part. I think women, we don't like that, have that, because it's rather hard to buy clothes sometimes. But this I'm just talking about the health part. So this is some of the things, or just generally, if we just kind of look more heavy than we were before, or our clothes are not fitting, then these are all telltale signs actually for ourselves as well, that we've put on some weight.
Now, I know there are many factors actually that can contribute to obesity. What are the factors? Psychological, physical?
Yeah, so actually many things actually can trigger us to start putting on weight. So for example, for women in particular, a lot of life events, in particular after getting married, actually men and women, happily ever after, or happily then after that, lots of happily dining together. It could be also life events for women, pregnancy in particular. And a lot of women in Asia, especially, we eat for two, right? And then after that, we gain a lot of weight. And after that, when we are having the baby confinement, we have eat some more. And then after that, with all the sleep disruption, so sleep disruption is a big thing. People can't lose the weight easily. People who go on shift work, for example, or for some reason have sleep disruption. Things like anxiety, depression, it's like a stress state to the body. And all these also can result in that psychological stress. So stress eating is a big factor. Now, COVID, work from home, right? Because again, a whole change, a new stress, boredom, because I need to go find something to eat, not because I'm hungry, right? So this food-seeking behavior. So all these are kind of the triggers, or even illnesses. So for example, someone got a severe illness and they used to be more active. And then when that hit, they're less active, or some medications, right, that they were given for the conditions that can then put on weight very easily. So these are some of the key factors, and genetic also plays a very big role. Yeah.
I see. Okay, one more last question for you, Dr. Tam. Now, which group of people should be more concerned about the condition? We're talking about the age group here.
Sorry, you're talking about the age group, the younger age group? Yeah. So,
younger or older, which group should be more concerned about being fat?
Okay, good. So, if I want to put my money in, I want to invest more in our children. I will always say children are our future, health included. And if we go even before that, mothers or mothers to be, because women who are overweight or gain a lot of weight in their pregnancy actually pass a lot of these signals, or in short, like a metabolic programming to their children. So in a way, then the children are born with such programming, or like genes, or this influence already. And that then makes them more easily put on weight more easily, or tend to respond to weight more unhealthily. Then maybe they may not be very overweight, but they put on a little bit of weight and they tend to get more diabetes risk and heart disease risk, etc. So the women in their reproductive age and young children, because children tend to stay overweight, because if you don't lose the weight, usually by your teenagehood, 70% will remain obese or overweight. And then that already during their childhood, they're clocking some metabolic risks. So we do see children nowadays with type 2 diabetes, things like obstructive sleep apnea, or even fatty liver, because they were overweight, obese since they were young as children. So a lot of risk for them.
I see. Yes, of course, there will be many of the advertisements about junk food and all that. Yeah. Now, also, thank you very much to Dr. Tam for all the questions answered. Now, let's go to Dr. Koh, ladies and gentlemen. Now, Dr. Koh, what are the complications of obesity? Tell us a bit more. We need you to unmute your mic. Thank you very much.
Good afternoon, Samson. Thank you, Dr. Tam. So the complications of obesity include diabetes and heart disease. People who are obese have a higher risk of developing type 2 diabetes, which is also known as insulin-resistant or adult-onset diabetes. This occurs when the body cells are unable to use insulin effectively, resulting in a persistently high sugar level in the blood. The research suggests, as you have mentioned earlier, Samson, that people who are obese are up to 80 times more likely to develop type 2 diabetes than those who are not. In patients who are obese, Cells of fat tissues have to process more nutrients than they can manage. The stress in these cells triggers an inflammatory response that gives rise to the production of proteins called cytokines. Now, cytokines then go on to block the signals of the insulin receptors and gradually causes the cells to become resistant to insulin. They can no longer hear the insulin signal to bring in the sugar from the blood. So when this happens, this is how high blood sugar levels occur in patients who are insulin resistant.
Now, what are the signs and symptoms of diabetes? How can one know that they have diabetes?
So as doctors in clinics, the most common, the top 3 symptoms that we would check whenever we see someone in whom we suspect having high sugar levels, it would be first, a sense of thirst. They keep needing to drink water. Second, coming along with a lot of passing of urine. They'll drink water, they'll pass urine, they'll drink water, they'll pass urine. These medical terms for thirst are polydipsia, and for passing a lot of urine, polyuria. Now, the third symptom we always watch out for is a loss of weight, despite having a very good appetite, because they're losing all that calories in that high sugary urine. So polyuria, polydipsia, and weight loss. If you have any of these, if you have these 3 symptoms together, please get yourself checked. Other symptoms that we would look out for sometimes would be a blurring of vision. When the sugar levels run too high, it affects the eye, and also very poor healing of cuts and wounds because there's an impaired immune response. Sometimes patient can feel itchy, especially around the sensitive areas like the genitals. Another symptom would be feeling hungry all the time.
So look out for the symptoms, ladies and gentlemen. If you do have experienced some of the symptoms, please consult your doctor as soon as possible. Now, we have a question for either one of the speakers here. Now, how will obesity and diabetes affect heart health? Are they related in one way or another? Anyone can answer this?
Yes, certainly. So an obese person's risk of a heart attack is actually 3 times higher than a patient who has a healthy body weight. Being overweight can lead to fatty material building up in your arteries. Arteries are vessels that carry blood to the organs. And if the arteries that carry blood to your heart get clogged, it can lead to a heart attack. So for diabetes increases the risk of atherosclerosis, which is the process of cholesterol plaque buildup within the blood vessels, by 2 to 3 times. And adults with diabetes are 2 to 4 times more likely to have cardiovascular disease than patients without diabetes. This is because over time, having all that sugar running around in your blood vessels from diabetes damages the blood vessels and also the nerves that control the heart and the blood vessels. This in turn results in potentially severe heart disease, such as coronary heart disease, which gives rise to what we commonly know as heart attacks, that sudden chest pain, that sudden collapse that you see on TV, And then downstream, after recurrent heart attacks, patients can end up with heart failure. The pump doesn't pump very well anymore. They are not as energetic. They get breathless. They can no longer do the activities they used to love. And lastly, independent of blood vessel blockage, diabetes can also give rise to heart failure without needing to block your blood vessels. So it's actually very frightening.
Well, I can sense, yes, from your description, yes, it's pretty scary hearing from your description, Dr. Natalie Cole. But I think it's important to drive the message. Yes, Dr. Tom?
Yes, I know. I was going to agree with Natalie and just, because we see the end products of all these, I treat patients with diabetes all the time. We nag and nag because we don't want to see them suffering from all these severe things to lose the weight. So actually people with diabetes and then obese actually also do a lot worse. They also get heart failure without having a heart is still quite strong. The mass is there. In fact, they have a thick heart and then they get heart failure. They move a little bit, they get breathless. And then also they get irregular heart rhythms like atrial fibrillation or even risk of sudden death. And this has been shown in studies, that obesity and diabetes puts people at risk of. So we're just reporting the facts. We're not trying to scare anyone. So do take care. Yeah.
Well, as it is, folks, the facts are true. These are from medical experts. Now, we have a question for Prof. Tan. What are the signs and symptoms of heart attack, since the doctors are speaking about heart attack? How can we know, or how do we know we have these illnesses in ourselves? Prof. Tan?
That's an excellent question. Not so easy to answer though. So maybe Samson, I'd like to state there are two main presentation. One is typical, one is atypical, and maybe the subset for the diabetes as well. So I would say typical symptoms, when you restrict or suddenly occlude blood supply to the heart muscle, you feel chest pain, it can be crushing, you feel like something sitting on your chest, you will feel breathless, sudden cold sweating, sometimes the radiation or the discomfort to the left arm, to the jawline. And these are very classical symptoms of when your heart muscles start to experience cell death and really great discomfort. Unfortunately, there's that atypical presentation, particularly for the subgroup of patients with diabetes, because diabetic patients, as Dr. Tam will tell you, has a lot of their nerves also involved in neuropathy. So they may not feel the same type of a crushing chest pain as a typical heart attack presentation. So occasionally they feel dizzy, there's some cold sweating, they feel breathless all of a sudden without much of a symptom. So they can have some radiated pain, they can have some epigastric pain, and often because the heart attack in these cases are atypical in presentation and doesn't feel as bad, they tend to ignore these symptoms and think that it's related to maybe low sugar and such and present very late. And therefore, this subgroup of patients, not over and above the fact that the disease usually is very diffuse, they also present quite late. So it's quite distressing for us because some of these cases present very, very late. So I would say anyone with any risk factors for heart attack, if you have any of the typical symptoms, please come and see your doctor earlier. Or if you are at home, in our experience, a lot of patients at home, the first person they call for chest pain is their father, mother, brother. They don't call an ambulance. They try to get their friends to fetch them to the A&E. So please just 995. If you need to, call ambulance, call for help. Thanks, Samson, back to you.
Well, that's true. So apart from people who are ill and having diabetes will actually affect the heart health as well, some fit people or some sporty people also can fall into the heart illness category. So basically there's no discount whether you're fit or you're ill. Best to check a doctor even if you have the slightest symptom, because sometimes, as you mentioned, the symptoms are not seen. All right, but if you have any slightest symptom, don't discount, just go to the doctor. Am I right?
Maybe I'll add on to that. I think what you say is so right, because actually those fit marathoners are the ones that, because they think they are physically very fit, they are immortal and have no cardiovascular issues. In fact, we often see, particularly in the younger age group, 40, 50, because they can run a marathon, they think they have no heart disease. So firstly, I want to put that myth out of the way. If you're fit, doesn't imply that your tubes are clean. So it could well be that you have significant heart disease, it's just that it's not manifested. And if you have symptoms, you do have to attend, like what Samson said. Thank you very much, Sam.
Thank you, True. Or could be over-exercising, yeah? Now, let's move back to another question for you, Prof. Tan. Now, based on your experience, can you provide some insights into difficulties or rather to the attitudes and perceptions that the general population have towards people who have CVD and diabetes in Singapore?
I think folks are actually at the moment quite aware that diabetes, because of the public education, the war on diabetes, is quite well transmitted, that they are at risk of getting heart diseases. I would think that actually that subgroup knows, but there's still a lot of fear for a lot of people to seek help. And a lot of times people don't really want to know. So there's a lot of resistance to getting their heart checked. And there is a health denial type of syndrome. And we actually a lot of times depend on our colleagues to prime them or to persuade them to seek help and get referred from either primary care or the endocrinologist to seek help, especially if they start having symptoms. The asymptomatic ones is a bit of a difficult conversation, because we don't necessarily need to test everyone with diabetes, because once you have diabetes, I think your chance of an occult heart disease is quite high. We treat your risk factors as if most times that you have, and we don't necessarily run further tests. But a lot of our primary practitioners and endocrinologists are actually very good at sending those folks into a cardiologist for assessment anytime they have any abnormal ECG symptoms and concerns to be referred. Thanks, Samson.
Thank you, Prof. Tan. Now, ladies and gentlemen, that's the reason why we have the Singapore Heart Foundation show for you guys, these health talks, some video shows on YouTube. So be sure to join us for Go Red for Women or the Singapore Heart Foundation World Heart Day as well. These shows are for you, and do bring in your seniors as well, like grandpa and grandma, and educate them more about heart health. Now, I have a question now for Dr. Tam. Now, Dr. Tam, how about obesity? Do you think there is a stigma towards people who are obese and not coming forward?
Definitely. I think, thank you for that question, because I can go on and on, but I will not, because it's something that I think, especially people who are very obese, in fact, stigma means there's a biasness towards them. And then when people have bias against them, in fact, for example, they may not get the same job opportunities even. And obesity can really affect people with the 4 M's. You know, we like our M's, but the M could be mental, and mechanical, like your joint problems, and M also can be your money issues. So people may not, be so of a lower socioeconomic group, but then they don't have the same opportunities sometimes with other people. And then metabolic, we're really talking about. So in terms of this whole biasness, actually, sadly, it comes a lot from families. About 70% is the family, for example, and especially people who are listening in. And you have family members who you want to encourage to lose weight, right? We use things like, why you so fat? Why you eat so much? Why you not disciplined? So these kind of things are maybe true to a certain extent, but then we start labeling people as you didn't try hard enough, right? Or you're just like that. Those who eat so much, they can't no control. So this is a biasness. And actually a lot of it also comes from us, healthcare professionals, right? And because of that, 2 ends. People who are overweight, obese don't come forward for treatment. They don't come for the screening that they really, really need, like Jack has talked about, that we've been highlighting. A lot is asymptomatic. Or we as healthcare professionals don't say, this guy needs this test. You don't need to screen for this. We actually don't propose these testings as much as if somebody was overweight. So these are all silent biases that we have. And societal has also brought that upon us, especially with, for example, the waves of Asian, you must look a certain way, right? So then people say, I must look like that, then I am good, I'm perfect, right? Then there's all this thing about eating right, eating good, bad food, good food, so much about that, right? So it becomes a labeling. So when someone has tried and then they lost a bit of weight and regained, they then feel very frustrated and even shameful. And these are all real. Right, so I think the stigma is very, very real in obesity. And if we don't address this both as healthcare and as family members, we will never be able to help our family. So I agree, it's very real. And even as employers, right, or as friends and family, let's be understanding, because it is a medical problem. People are not because they're ill-disciplined. There are a lot of things that are ticking it behind, just as how you develop a heart disease, just as how you develop diabetes, hypertension. There are all these other bodily function impairments that resulted in that. Yeah.
Mm-hmm. Now, also, most people say, or most people think that my weight loss is completely my responsibility. What are your thoughts about this statement?
Definitely, it's a true statement. So in fact, in Singapore, we did our own survey that stemmed out from one of our healthcare centers. The public came in, and actually 90% of them felt that it was their responsibility. So, and it's a very interesting study because they're quite conflicted, right? Some know that it's a medical problem, yet they say, it's all my responsibility. That actually diet, exercise is okay. I'm not saying it's no good, but they just said, that's all I need to do. I need to try harder, right? So even if they tried it and they've not achieved, I wouldn't say failed, they just not achieved what they've done, or they've lost the weight and regained, they're still very shy to come and seek help. And also another misconception is that medications for weight loss are dangerous, including bariatric surgery, which we can talk a little bit about later, is very dangerous and all that. So while I say not everybody is suitable for weight loss medications and surgery, but there are a lot of people who are suitable, and the doctors can help out, healthcare professionals can help us. So that's why there's this whole a bridge in the gap. And now there are a lot of things online that people can very helpful, but some honestly are actually can be misleading, right? So if you have a medical condition like diabetes and heart disease, and you need to lose weight, I think getting healthcare professionals sooner would be more helpful to yourselves. Yeah.
Thank you, Dr. Tam. Now, next question I have is for both Prof. Tan and Dr. Koh. You may answer it differently. First question is, what can be done to reduce the risk of obesity, heart diseases, and diabetes? Maybe Prof. Tan to elaborate a bit more on the diet. Tell us a bit more, Prof. Tan.
I think it's just a simple math thing. Is in out. I think it's how much you put in versus how much you take out. So I think in order to lose weight, it has to go on a slightly negative ratio. You do have to moderate your diet in terms of how much you put in terms of calories. So I think a balanced diet, in general, we advise not too much carbohydrates, more fresh vegetables, fruits, but not too sweet, of course, and moderate the amount of meat intake. And at the end of the day, you do have to watch a total amount of intake of calories and balance it against exercise. I think in Singapore, the fact of the matter is no matter how much you exercise, you cannot use up those calories that you take in excess. For weight loss in particular, the calorie restriction is particularly important. I think recently there are a lot of myths out there about diet. It is a complex topic, and a lot of myths and hoax and like pictures for Atkins diet, for some form of weight loss diet. But at the end of the day, it boils down to moderation. As well as moderate exercise, when you are on the heavier side, and if you start on too aggressive exercise routine, firstly, the amount of calorie expenditure may not be that great. Secondly, you may end up hurting yourself and feeling very, very discouraged. So you have to be careful and embark on that journey. Dr. Tam used to run this life center in SGH that I love referring patients to. They have a great experience there because it doesn't just combine, it combines three things, I would say. One, the advice on diet and the appropriate diet. Two, the appropriate exercise so as not to injure yourself and slowly graduate it up. And more importantly, a lot of people neglect it is the social, emotional support group that people need to maintain and go through that journey. And then, of course, with Dr. Tam there, she can always spot the ones that may have crossed the barrier such that they may be more appropriately managed with more aggressive therapy like medication or bariatric surgery, for example. And I've seen a lot of patients benefit through this journey. I would say perhaps 10% of them do need more invasive type of management, but the great majority, 90% with this type of measures, do very, very well with a formalized program for weight loss. So don't be shy. Please, if you recognize that it's time for change, if you hear this webinar, seek out and ask for it. We can get you appropriately placed. Back to you, Nat.
All right. Now, ladies and gentlemen, as you're watching this program now, don't forget to reach out to any of the speakers as well later in the Q&A session. You can actually type in your questions, like where can you go for some, social help as well, some counseling, some advice as well. Do feel free to type in your questions during the Q&A. Okay, don't be shy. Find out what are the ways that you can reach out to all our panelists and our speakers and professionals. Okay, to Dr. Koh right now. To Dr. Koh. Now, can you elaborate more on lifestyle, healthy lifestyle? How do you keep yourself healthy and lower your blood sugar as well?
It's so hard to answer this question because Prof. Tan has already answered it, to perfection. Every point I wanted to raise, he has. I have to say it's such an honor to be on this panel with Dr. Jack Tan and Dr. Tam because of the excellent work that they did. They inspired my own practice. And I think it's important, as Dr. Tan says, to recognize that, there is professional help available. If you have tried and tried again, had some success, but cannot maintain this success or have never achieved any amount of satisfaction in your weight loss journey. Recognize it as something that you don't need to do alone. We are advocating for you to seek the help that you need, and that is the purpose of this panel. So I think that, Dr. Tan has touched very nicely on diets. We should not be focused on fad diets. We should be focused on doing weight loss in an appropriate manner. You may need a professional to help you make sure you get enough protein, enough nutrients, even as you journey towards caloric restriction. Second, when it comes to exercise, Dr. Tan has mentioned also it's difficult to initiate this when we are carrying a lot of extra weight around. Sometimes our joints hurt. How do we even begin? So the number that we're looking at is 150 minutes a week. It's not so strict as, okay, 30 minutes every day, go, go, go. It's not that way. Whatever you can do, you start off by doing. Do what is not so difficult to achieve. Is it climbing a few steps first? Is it walking with the kids, walking with your friends, slowly at a slower pace to begin with? Is it walking in a swimming pool in the shallow end because your joints hurt and you cannot weight bear? So things that you can manage. It is not such a big barrier if you break it down into smaller bits. That's exercise. The third thing that Dr. Tan mentioned is the psychological and the social support. The fact that you have tuned in today, you already recognize the importance of weight as part of your overall health. And that is insight that money cannot buy and doctors cannot teach. So that is the first step already. Understanding that sometimes we have triggers that make us binge, and we may need to see a professional like a psychologist to help us rewire our brains. Of course, there is a medical term for this. It's called cognitive behavioral therapy, but in simple English, it's to address that underlying trigger that may result in you consuming more calories than you need. Sometimes it's underlying anxiety or depression, and this is something we have faced in a pandemic that has dragged on and on. So this is very important, the psychological space and the social support, finding a network and we will give you the resources later that you can Google, that you can log in to see other people who are journeying with you. So these three things are very key. And the next more drastic steps, if your medical team deems fit, would be to introduce medical therapy or even surgery, but they're way, way down the line. For now, if this is your first step into losing weight, three things: watching your diet, making that first move literally to move a little bit more, clock in those 150 minutes if you can. And thirdly, watching what could trigger you psychologically to consume more than you need. Yep. Back to you, Sam.
Thank you so much for the information. Now, I heard somewhere already, I saw an advertisement that they say walking is good for you. Just walk like maybe 1 kilometer a day or 2 kilometers a day will extend your life. So as you mentioned, you just got to go out there and start something. So I think walking is the most basic thing that almost a lot of people can do. Right, some simple exercises. Thank you so much for that, Dr. Ko. Now, ladies and gentlemen, it is found that out of the 400,000 people who has diabetes in Singapore, 1 out of 3 are unaware of their condition. Now, similarly for CVD as well, we often do not know we have the condition until it's too late. So question to Prof. Tan right now is, what causes the delay in people seeking treatment in Singapore? Is it due to the lack of awareness of the condition, the relatively low understanding of treatment options, or is there an unease surrounding medications among general public? How can we improve this, Prof?
I thought this question is better answered by Dr. Tam, but I'll give it my best shot. I think the Singapore's healthcare system is actually pretty good. I think the population that is unaware of them having diabetes is gradually becoming less and less. It's not difficult to screen for diabetes. I think the pre-diabetes stage, sometimes we use what is called a glucose challenge test. A bit more tedious to do, but we can use that as a way to prime people to say that, oh, I think you might have insulin or glucose intolerance. So try to moderate the amount of intake of carbohydrate and sugars. And then we can track this group a little bit more to hold back the progression to frank diabetes. Now, of course, there are simple tests like sugar checks, HbA1c, that will diagnose your diabetes quite early. We rarely, at least I rarely find that subgroup of patients where they have a lot of ants around their toilet bowl before they come in and say, I have diabetes. That subgroup seems to have been less and less. The issue of occult heart disease is a bit more challenging, I think. We tend to look at risk factors first. Then we look at a 10-year risk profile for this group of patients. We don't jump in to try to screen for occult heart diseases off the bat if they are asymptomatic. A lot of times, because it still doesn't change the risk profile for this group of patients without tackling their underlying problems. So we are quite focused about managing their weight, their blood pressure, their lipids, and their diabetes control before we talk about anything else. A lot of people don't realize it, but the risk for this group for modifier risk factors like sedentary lifestyle and particularly cigarette smoking is the killer, not somehow trying to find out whether you have heart diseases or not. But of course, a lot of people want to find out, get reassured, and then they disappear. The subgroup in Singapore I find is a problem is those are diagnosed with diabetes, they take the medicine, they get tired of it, then they say, I'm fine. And they think they are cured once it's controlled, and they drop out for a few years. Then they come back with a lot of manifest disease. So that subgroup I must find that is quite frustrating. So I think we continue to work on all the spectrum, pre, during, and ensuring compliance, because it is a long-term palliative disease for us. Thanks, Samson.
Well, I agree, Prof, because I've seen my mom's medication. It was like a heap of medication, this much she has to eat every day. And I realized this is true. You can get tired of eating the medication. You can just sometimes give up and forget. But of course, with counseling and therapy and family support, right, that will actually help a lot. All right, next question for Dr. Tam. Now, what would be the case of obesity? In this case, would it lean towards the low understanding of treatment options, or is there an unease surrounding medications for treating obesity? I'm sure some of the patients are concerned about this as well.
Yeah, it's a very good question. So I think we've alluded to that earlier. I think people may think that obesity is just putting a little bit of weight, which happens to most of us with time, with age, or with life events, right? So I think people take it as a natural course of things. Which is true in some ways, but I think what we want to focus that comes with an increased risk of the most feared of diabetes and heart disease. So a lot of people will be like, oh, doctor, do I have diabetes? They're so afraid of the diabetes. Or do I have heart, right? And they're willing to spend a lot on these measures to find out or even to treat it or prevent it. But I think people forget, and that's why the topic today, right? Obesity, heart disease, obesity in brackets, diabetes and heart disease, because obesity actually is so linked to diabetes. We call it I call it a Siamese twins in some ways. It's really, and there's a term called diabesity, diabetes with obesity, and the research is over decades proven beyond doubt that even without genes, right, obesity confers 80% of the risk for diabetes, right? So people say, oh, I don't have family history, I'm okay for diabetes. But at the end of the day, this obesity you need to be aware that it comes with a whole host of issues. I mean, today we're only focusing on two. There's a lot of things like fatty liver, sleep apnea, even infertility, and cancer risk, actually, which is not the topic. It's a huge topic on its own. Another big C that people are fearful of. But we need to go upstream, right? And hence our government is very generous in pushing in subsidies and giving free screening for all of us, for most of us, cholesterol and all that, right? To try to prevent these costly endpoints, which our two specialists here are dealing with day in, day out, right? And which we didn't have to in some ways, right? So and myself for diabetes and its complications, right? So I think we need to be aware that obesity, if you're not sure if it's affecting your health, go for a check. right? So and 40 years old, we're all supposed to go for a check regardless of our weight. But if we have a little bit more weight, or we realize I'm not getting so healthy, I'm getting more sluggish, especially with this whole work from home issue and COVID stress, just go for a checkup, right? You can go to Health Hub and then you can see whether you got free screening. Just pay $5, you get screening. It's very cheap and good. And then from there we can see, has the weight affected your risk factors for what Dr. Jack and Natalie has talked about, right? Then we go on from there. So I think just awareness that obesity is a medical problem, or can be a very serious medical problem, just to acknowledge that first. And I think, as you said, it's a low understanding of that, right? And family members, you say, hey, come, let's go for a checkup together. Like we go shopping together, we like to go eat together, right? Hey, let's go for a health checkup together, right? So I think it's a very positive thing, right? Because when our family members are sick, we are also kind of like burdened with their sickness, or we're worried, and all that, and it affects us in many ways. So I think it's good to get that start and then acknowledge that. And in fact, the same research that I've talked about earlier, actually 90% of people didn't realize their weight was in the wrong category. It's quite alarming for ourselves too, right? Because we're in this day in, day out, we can assess very quickly. But a lot of people, because people have already grown bigger over the years, right? So just taking a look at that, people might not think they're overweight or have a problem. So they accept that as normal. But we realize that 90% people who are overweight or obese think they're either normal or just maybe a little bit tubby, It's okay, it comes with age, right? So I think that tells us that we need to do a lot more as physicians and for example, Heart Foundation and our society, to really bring up the awareness. And we're really glad that people are here today, and please spread the news awareness as well. Yeah, we answered that question.
Yes, you did. Thank you very much. And of course, that's the reason why we have the Singapore Heart Foundation Facebook and YouTube channel as well. So ladies and gentlemen, do your bit. If you're a youngster, if you're a teenager, please encourage your grandpa, grandma to watch the show as well, and to bring them for a checkup. A $5 checkup can actually save you $50,000 in medical bills. Prevention is always better than cure. So that's the reason why we have this program. And we're so thankful to have Prof. Tan, Dr. Tan, and Dr. Ko with us on this very, very special time together. Now, we have one final question before we go to the Q&A, where we invite you guys to type in your questions in the YouTube channel. But right now, folks, final question to Dr. Ko. All right, Dr. Ko. Now, as Dr. Tan mentioned earlier on, we are now in the COVID-19 epidemic period. Now, do you have any precaution or advice for people living with obesity? This is regards to COVID-19 pandemic, to Dr. Ko. Does people with heart issues have more problems prone to the pandemic? Can you tell us a bit more?
Thank you, Sam, for the excellent question. And this is the elephant in the room that each of us have referred to throughout the entire conversation. I have 5 points I want to make. And right at number 1 is vaccinate. If you have no contraindication to vaccination, if you have obesity, diabetes, heart disease, do not delay. If you're not one of the 75% who has gotten your first shot, quickly go. Why? Having obesity increases the risk of severe illness from COVID-19. People who are overweight may also be at increased risk. People postulate this is because obesity is linked to impaired immune function. Now, what are the numbers? Having obesity may triple the risk of hospitalization due to a COVID-19 infection. So I say it again, point number 1, pertaining to this pandemic, if you have obesity, diabetes, and heart disease, and you're not yet one of those who've received your shot, quickly go. Do not delay if you have no contraindications. Now, the second point, keep exercising. It's so hard to wear a mask and walk because you're not allowed to take it off unless you're running, and it's hard to run when you're carrying all that weight. Keep at it. Please do. We've alluded to the importance of 150 minutes a week. Get what you can in, even in a pandemic. It's not a reason to avoid that. Third, watch your nutritional intake during this period. It's hard because, we're not allowed to dine in. We've been ordering in. Food is comfort, but please keep an eye on it as we journey through the pandemic and ride it out. Fourth, watch your mood. Watch your triggers, avoid trigger eating. Try to see if you need to see a professional, if you really need to see a psychologist for what we had earlier discussed. mood management, cognitive behavioral therapy, especially if the stress is triggering binging. Fifth, please keep your appointments with your doctors. There is a pandemic out there, but it's under control. Please do not avoid attending appointments that would be needed for you to continue care for chronic disease. And for you to and please do not forget to adhere to your medications and all your routine tests and consults. Do not let the pandemic get in the way of how well you manage your chronic illness. So 5 things, I'll repeat them one more time. First, vaccinate if you have no contraindications. Second, keep exercising even if you have to get that mask on. Third, watch your food intake, even though it may be comforting to eat good food. Fourth, watch your mood, watch your stress levels. Fifth, keep your appointments with your doctors. Don't let the pandemic get in the way of your chronic disease control. Back to you, Sam.
Thank you very much, Dr. Koh. Thank you so much. So remember, guys, the 5 points, very important points. And in general, folks, of course, the COVID-19 pandemic affects people with cardiovascular diseases, your breathing, your respiratory. So, respiratory affects many things, right? So moving along, we have some questions from the public. We have friends like Patrick. Okay, Patrick, this question goes out to Prof. Tan. Now, could there be an underlying heart problem if I feel chest pains triggered by wind and cold weather after it rains? Is it related? Is it not asthma, or is it not something else? Is it related?
Thanks for the question, Patrick. It deserves a consult by itself. So I think any form of chest pain needs to be evaluated. We, as cardiologists, what we do look at is to look at your risk profile first and look at the nature of the chest discomfort. So you do have chest pain triggered by cold weather. It's actually possible to have underlying heart disease. We know in the colder countries, heart attack rates are actually increased in winter months, especially cold weather. There's a lot of like constriction of blood vessels in the cold weather. But the other symptoms you may want to ask yourself is that, do you have the same chest discomfort when you exert yourself, for example, climbing some stairs, walking a bit faster, whether it's triggered by exertion, and whether you do have those risk factors that we are concerned about that can also cause coronary artery disease like diabetes, hypertension, high cholesterol. And I think if you are at all concerned, and I can see you are by asking the question, please seek a formal consultation with your doctor. Thanks, Patrick.
Oh, thank you very much. I didn't know that question. I didn't know that cold weather could actually affect people with cardiovascular diseases. Wow, that's something new for me to know. Well, next question to Dr. Tam from Sitting. He or she asked this question: do you recommend for an obese person to control the diet first to lose weight before slowly starting to exercise? What's your say on this, Dr. Tam?
Yeah, thanks, Sitting, for the question. Very good question. So I think we generally encourage in tandem. So as Dr. Jack Tan and Dr. Natalie has spoken a lot about, I think we can start in tandem. Now, obviously, when somebody has an issue exercising because of joint issues or very severe shortness of breath, or we encourage sometimes a little bit of weight loss first, or get a professional help to guide us in the exercise, or even just moving more, right? So actually, another thing that we didn't cover was to cut sedentary time. Sedentary means to sit, right? So sedentary time, so we've cut the sedentary time. It's also shown to improve, firstly, our heart disease risk and also our heart function and all that. So I think just move more, right? It doesn't, for example, taking the stairs instead of taking the lift, or maybe the escalators up to, so you just take stairs one and then the escalator up. So just move more. Or for example, people who work from home, trying to stand or move on the spot while you're Zooming or using the phone, or people watching TV during the break time, just break that cycle. So that's cutting sedentary time. Maybe you could start with that. And even exercise doesn't mean you have to huff and puff, right? Or sweat a whole lot, right? So even we call resistance exercises, taking a band and doing some stretches, very simple sit to squat, just strengthening the muscles first could be good. Because if our muscles are no good, also when we exercise, we'll hurt ourselves. Now, but the long and short is actually often with weight loss, diet, as Dr. Jack I think mentioned, is the key thing. If you don't cut the diet, actually it's very hard to lose weight. To rely on exercise alone, especially when we are not used to exercising or our exercise tolerance is very low. So you definitely need to have the dietary input, the restriction in there, and then bring the exercise in. Now, exercise also does one thing more than weight. It keeps your muscle mass. So when we lose weight, we also lose muscle. Okay, but we want to concentrate on losing more fat and try to keep that muscle, because it also kind of helps to preserve a bit of the metabolic rate when we're losing weight, and also the function, including heart function as well. So that's and also tends to help us keep the weight off in the long term. So exercise has these two benefits plus one more: cardiovascular health, right? Regardless of weight. Yeah. So start slow, but move up. And if in doubt, seek help. In fact, Heart Foundation also has a lot of resources in terms of exercise that you can try to explore. Yeah.
Thank you, Dr. Tam. And of course, coming from me, I'm not an expert or I would say an advisor, but generally I've seen some people watching TV, but they're not on the couch. These are my friends. They have a walking machine. So you can watch TV and walk at the same time, or do some jogging while watching your TV. And some people say, I need to go to the gym. I don't have a gym membership. Well, you have 1.5 liter bottles at home. You can fill up with water and, you do a bit of exercise again as dumbbells watching TV. So you have many ways that you can work along to keep yourself fit, even you're at home. And also to the taxi drivers as well. They drive long hours, as you mentioned. You need to get out and not sit too long. So do have some breaks, some regular breaks, and drink plenty of water. Some of them don't want to drink water because they can't find a toilet. But these are some things that we have to look into it. Maybe they can help change their lifestyle. Now, we have a question here for Dr. Net. Question from Kachin. How frequently should we monitor our blood pressure levels?
Sam, I just have to say, kudos to you for bringing alive our discussion. I love how you related to how people receive this information. And I'm right with you on the walking pad, because I have one just to make sure I clock in those steps between the Zooms. Okay, but yes, back to the question. How frequently should we measure our blood pressure levels? If you have high blood pressure and are on medication, this is especially important. But even if you don't, and you want to keep an eye on what your baseline blood pressure is, this is useful too. Basically, this information is for everyone. So how often do you measure it? You should measure it twice daily. And this is from the Mayo Clinic's advice based on the American Heart Association guidelines. The first measurement should be in the morning before eating or taking any medications, and the second in the evening. Now, each time that you measure, take 2 to 3 readings to make sure that your results are accurate and note them down. Okay. And most of us, we would recommend that you take your readings at the same time every day. Okay. Some pro tips when it comes to measuring your blood pressure. Don't measure your blood pressure right after you wake up. Okay. It may be a little bit high. Avoid food, caffeine, tobacco, and alcohol for at least 30 minutes before taking a measurement. But when it comes to tobacco, it should be all the time. Sit quietly before and during the monitoring. Make sure your arm is positioned properly at 90 degrees at heart level. I wish I could show you more clearly on the screen. Okay. Place the cuff on the bare skin, not over your clothing. Okay. And then repeat it. Note down your readings. So I hope that was useful information, because blood pressure is something that when we measure in the office, in clinic with you, studies have shown that the number we get in clinics is about 5 mmHg, okay, higher than if you were to measure at home. And we always like to know what the baseline reading is, because there is a phenomenon called white coat hypertension, where a patient's blood pressure can go up by 10 to 20% simply at the thought and fear of seeing a doctor in clinic. Yeah. So I wonder what doctors' own blood pressure is, because we see ourselves every morning. Okay.
And sometimes the blood pressure can also increase when you see your bills as well, your bills coming in. Yeah. So don't look at your bills before you do.
Yeah, don't look at your bills before you measure, please. Oh my goodness.
Okay, thank you, Dr. Ko. Next question to Prof. Tan. A question from Yak Kian. I had angioplasty done last year. Would I be more at risk of a second heart attack?
Well, thanks for the question, Yapian. So firstly, unfortunately, you are more at risk compared to someone who never had angioplasty before for a second event. But I would say it depends on your clinical event, the degree of the blockages. Uh, though those information I don't have. For example, if you did your first angioplasty for a heart attack, then your risk for subsequent heart attack is actually fairly high, about 15-20% over the next year. What is the good news? The good news is that if you do maximize the risk factor control, again, we go back to the same thing. I keep repeating it. If you do control your diabetes extremely well, your cholesterol, if you drop your cholesterol to less than 1.7 millimoles, and if you can even drop it to 1.5 millimoles per liter with medication or with diet control, I think a risk for a second event is much lower. Now, of course, because you had angioplasty, I'm sure you've been placed on dual blood thinners, and you have to be very compliant with your blood thinners to also reduce subsequent events. So I would say three things. It's a wake-up call. I hope you're well now. It's a wake-up call to be more serious about risk factor control. It's a wake-up call to be more compliant with your medication. And it's a wake-up call to spend more quality time with your family and reduce stress in general. So I hope that helped. But the other thing I want to say, Yapian, is that my observation with a lot of patients who just had angioplasty done last year is a 2-year rule. The third year, they forget about all the pain, and then they go back to their old habits. So I would say, please persist. We are looking at a 10-year event rate. We're not looking for events in the next year. So persist with your risk factor control, and you must then endeavor to change your lifestyle from now to really reduce this chance of a second heart attack. Thanks, Sam, back to you.
Thank you, Prof. Tan, for the answers. Now, question to Dr. Tam from Lian Hui. She's asking, should a pre-diabetic person stop eating sweet foods completely to prevent their condition from worsening? What's your take on this, Dr. Tam?
Yeah, thanks, Lian Hui. It's a tricky question in the sense, so everybody thinks diabetes equals don't eat sweet foods, right? Okay, long and short is you don't have to stop eating, but you have to control the amount of sweet foods that you eat, because that makes your body, your pancreas, which produces the hormone to tackle sugar, work harder. And then you make it work very hard. Like you make a horse run and run and run and run. One day it's going to get tired, right? Then when your pancreas gets really tired, then it cannot produce insulin. That's when the full-blown diabetes happens, right? So you got to sayang your pancreas a bit. And another way to sayang your pancreas is also to lose the weight, because it's the weight that actually drives this whole pancreas working hard, or the insulin resistance. Not just the pancreas working hard, but your muscles and the fat cells do not respond to this insulin better. So they don't take in the sugar. Right, so when you eat a whole sugar load or the carbohydrate load, the sugar cannot go inside the blood cells, right? To stay inside the blood, you have a high blood sugar and hence the diabetes. So I think the whole long and short is actually the important thing is actually lose the weight. As like I mentioned earlier, these are like Siamese twins, right? So actually in Asia, unfortunately, we just need to be a little overweight. Our risk goes up very, very high, especially South Asians. The risk is quite phenomenal, even in the overweight range. Right, so if you just lose 5%, 5 to 7% of your weight, you can prevent the diabetes or reduce your risk by at least 60%. Now, if you lose even more weight, even 3 years, 5 years down the road, you can even keep it at bay, drop it by 90%, and even reverse the whole situation with the weight loss.
Wow, that's good to hear. That means it's reversible if you start early and if you start now. Wow. And also I've got a question as well. We know that some fruits, fruits are good, but some fruits are high in sugars as well. Am I right? So don't just take too much of fruits alone. They could be high in sugars. Any particular type of fruits that contain high sugars, Dr. Tam?
I think our taste buds will tell us that anything that's sweet, that's juicy. I think we always like to go for this fruit is sweet, therefore we'll buy a lot of that, right, for the family. So I think whatever goes that's sweet, I think there's no really good fruit or bad fruit. And in fact, we not limit, but we say like 2 fruits at least a day. And I think also the fiber is very important. So the higher fiber fruits, together with vegetables. So high fiber fruits and vegetables are generally very good for health in general and the weight. Yeah, and also not just sweet foods. I think we talked about carbohydrates. So refined carbohydrates. I think a lot of people are very well known, like brown rice, and more oats, but it's also the total amount. So it doesn't mean it's brown rice or it's any oats and then you can eat a lot of it. So again, the amount is also, the load is very important. The carbohydrate load and the quality is very important. Yeah.
So Dr.
Okay,
Tam,
true.
is a Mao San Wang bitter tasting durian good? To have?
Well, can. Everything in moderation, actually. I will never say don't touch. So I allow my patients to eat a lot of foods. It's just I tell them, look, you got to do exchanges, right? You want to eat your 5 seeds of Mao San Wang, you better cut your rice. Right? It's an exchange. Like a lot of things in life, right? It's about exchange, but you can't keep doing it and because that risk will chalk out. Yeah. Actually, I'm not a very durian person, but I think I know what's Mao San Wang.
I'm with you. I'm also not a very durian person, Dr. Tam.
Yeah, but limit, yeah.
Well, in general, I think, if the audience you need some help in finding out more about food and nutrition, you can always log on to the Health Promotion Board. They have some help in, showing you maybe a quarter of this, a quarter of that, a quarter of that. You can find out more information. Of course, we are all not dietitians here in this panel here. We have some in the previous talk show. So, again, you can always go back and view all the previous programs on the Singapore Heart Foundation YouTube channel. We have all the various programs on dietitian, food, heart health, COVID-19 pandemic, and many, many more. So we have one more question for Dr. Natalie. Now, this question from MJ. Now, can stress and anxiety causes heart disease? What do you think?
Thank you, MJ. Thank you, Sam. I think this question cannot be more timely. There has been so much focus on mental wellness and its importance. I think someone wise once said that the absence of a psychiatric condition or mental illness is not mental wellness. Okay. Can stress and anxiety cause heart disease? The answer in a nutshell is yes. I will elaborate a little bit more. Although the evidence that we have is more consistent for depression and traumatic stress for a direct correlation for heart disease, there are now sufficient studies that demonstrate that chronic anxiety and exposure to daily stressors also can have a negative impact on cardiovascular health. And I think it's hard to find someone who can say that they have not been affected by the pandemic that we have endured for the last 1.5 years. So the guidelines from major cardiac societies also reflect the growing recognition of the connection between mental and cardiovascular health. The American Heart Association now officially recognizes depression as a risk factor for poor prognosis among patients following heart attacks. In addition, the European guidelines have identified depression, anxiety, and psychosocial stressors, such as work-related stress or poor social support, as risk factors for incident cardiovascular disease, means developing new heart disease. And also in patients who already have heart disease, they have worse outcomes when they have such psychological stresses. However, there is a huge gap. Even though we have of late, in recent years, only begun to recognize the burden of psychology on our heart, more work needs to be done in order to establish first of all, how our mental health affects the heart. No one really knows. And second, to really develop effective treatments to reduce mental unwellness on cardiovascular morbidity and mortality. There really isn't very good treatment out there at the present, but work is being done. Basically, most guidelines will recommend getting evaluated and getting treatment if needed for the primary psychological disorder. It is very well known, especially in Asian societies, that psychological problems are underreported and undertreated. Data from the Western world found that the median time from symptom onset to first treatment contact was 8 years for major depressive disorder. 8 whole years before people sought help for major depressive disorder. And 9 to 23 years, can you imagine living with 2 decades for various types of anxiety disorders, including post-traumatic stress disorder? This is a lot of time lost with poor quality of life and living with mental unwellness. We are not thriving, okay? So the recognition of the damaging impact of psychological stress and disorders on physical health, like cardiovascular disease that we're talking about today, is important that we talk about it right now, because it could help us improve the adoption of screening as well as intervention that can reduce delays to receiving treatment, and for us and our patients to engage in better mental health care. The numbers don't lie. 8 years to time of diagnosis for major depressive disorder is 8 years too long. Back to you, Sam.
Thank you, Dr. Ko. So ladies and gentlemen, don't wait any longer, okay? Just go for your checkup if you feel uneasy with yourself, your mind, your body, physically, psychologically, okay? Don't wait till it's too long. Don't wait till it's 8 years. Any slight, feeling, go for it, yeah? Detect and quickly get it sorted out. Okay, I've got a question here for Dr. Tam. Now, this is rather strange. The question is rather strange, but enlighten us. Is becoming a vegetarian a way to prevent obesity?
I'm not sure, honestly, but I can only share with you what we know, in the sense that I think that there's data to say that if we eat a lot of fatty foods and red meats and all that, processed foods, right, we're at risk for people, sweet foods. People tend to observe that they tend to be more overweight and obese, have type 2 diabetes, fatty liver, and heart disease, right? So we learn from all these observations, like how people live and eat, what they do, and then we follow them up for like 8-10 years, right? Because these things don't develop like suddenly. Yeah, it takes 8 to 10 years to manifest. So they found that people. So I think if you choose to be a vegetarian, also I will always stress quality over quantity, right? So we talk about calories and all that, but I think in terms of what is in the calories is the quality. Like you need to take less processed foods, yeah, especially the ultra processed food, the quick foods like instant foods, biscuits, right? A lot of packaged foods that are very attractive, honestly, even to me. Don't talk about kids, right? So a lot of attractive foods, and also fats. What type of fats? So go for unsaturated fats, like poly and monounsaturated fats from plant sources in particular, or even from fishes, right? Things like that. So I think quality matters, then quantity, right? And that quantity and your quality. So if you cut the quantity, the calories, and then carefully choose your health foods, in a way, you are what you eat, or I'm what I eat, is very true. You know, if I'm skinny, but I can pump in a lot of lard or whatever, and hopefully I don't have bad genes. But if I have bad genes, then I have to see Prof. Jack and Natalie earlier, which, yeah, and I don't mind seeing them. I love seeing them, but it's costly as well, and I have to suffer and all that. So, you know, the quality of life comes in. So I think if I, all these really matters. So I would say that if you find going vegetarian is a good choice for yourself, then go ahead. But I wouldn't tell everybody to be vegetarian or vegan. But I would tell everybody, please cut down on your red meats, on processed food, and refined carbohydrates and more fiber and vegetable. I've been going to somebody else's question already, but in general, yeah, that's the long and short. And choose a diet that works for you, right? There's no one over the other. Choose something sensible that you can stick to, not something just for 3 months and then you gain like more weight than you've lost. Yeah, that's also another sensible diet.
Okay, so there you go, Jeffrey. I hope that answers your question. Okay, we have one more final question before we go into more of the resources details, where we can find the resources and how to reach you guys. This is going out to Prof. Tan. I think we've asked this question many times, but let's not discount it. Let's ask again. Now, does having high cholesterol and high blood pressure put me at a high risk of developing diabetes and heart disease? Prof. Tan?
Okay, so I think Samson is worth rehashing. Yes, the answer is yes. I think we do keep repeating it again and again. There are some stuff that is non-modifiable. For example, certain racial predisposition, your age, male gender, and your genetic makeup. Those are not modifiable, you can't change those. But what you can change is definitely some of the risk factors that you can develop, as well as your environment. So the smoking, the blood pressure, the diabetes, the weight, all these things actually is within your control and is very strongly associated. We do know that it's causal in terms of cholesterol levels that is too high in your bloodstream. Over many years, it does deposit in your coronary arteries. And the diabetes, if you do develop it, accelerate this process of getting a cholesterol into your coronary arteries. So again, it's worth rehashing again. All these are very strong risk factors. And how does the obesity interplay into it? The obesity just is like a cardiometabolic profile that wraps all around, overwhelms it. I think the sleep apnea that is associated with it predisposes you to poorer blood pressure control, poorer diabetes control, increases the stress level in general in your body overnight as well as the day because you're not rested well, and also increases your level of cortisol and everything, and it just makes everything worse. So this whole conundrum just accelerate development of coronary artery disease. And I must say, in modern day living, especially in Singapore nowadays, in city living, we are unfortunately seeing a larger and larger cohort of our population developing coronary artery disease at a much, much younger age. So this is something that we really have to arrest and stop in the younger age. But look at those modifier risk factors first. It is within your control. And again, I would like to impeach everyone to work harder at modifying those risk factors. Back to you, Sam.
Thank you, Prof. Tan. Now, questions to Dr. Tam coming from Dave Koh. Now, as Asians, rice is our staple food. How do we reject it as part of our staple food? Now, eating clean is also expensive per se. Now, I tried, and it does not beat a plate of chai ping for just $3. So how do we replace rice in this matter?
Yeah, thanks, Dave. That's a great question because, I'm a riceaholic. I love rice. I'm so Asian that way, and I can totally identify with you. But I think to start off with, we maybe cut on the portion, because for me, I used to be able to. You can't tell now. I used to be very overweight myself, and I can eat 2 bowls of rice no sweat and fast, right? But then over the years, I have to train myself then to cut the amount of rice, such that I'm able to actually now just take maybe half a bowl and I'm happy. So a lot of times, it's not just about the fullness; it's about our satisfaction of food, so you can train yourself slowly to maybe cut down on the amount, and as mentioned, to choose maybe higher fiber rice, like brown rice. Some places give discount, like 50 cents. I think some stores give that as well, and to encourage, or then that in itself will also increase the fullness. So sometimes we'll eat less. Then choosing the dishes that are healthier. And you mentioned Chai Peng. It's also my favorite cuisine in Singapore. You get the variety. So again, you look out for things that firstly try to minimize your fried food for a start. These are very calorie dense foods, right? And also things that are, for example, if it looks really oily, got a lot of oil swimming around, especially things that are stir fried with chili, right? Obviously, they need a lot of oil to fry the chili. Then you kind of go easy on this, or maybe it's your treat days, right? So I would say go completely clean. I think a balance is good, because if people go too restrictive, they say, "Hayo, tak boleh tahan," give up. They may bounce back and just drop all measures. So I think it's important to say, okay, maybe 3 times a week, I'll eat really clean. Okay, I spend a little bit more. I know the boring salads and all that, but sometimes they can be very delicious and can be affordable in some places because they're so popular and competitive. For $5, sometimes you get quite a decent balanced diet and salad, or yong tau fu, fish soup. Sometimes, these are the cleaner ones, and maybe less of the carbs and all that. So that's still doable. And I agree that it can sometimes be excessive, but I think maybe we just balance out with, we say, try 3 times a day. And then we work it towards a more workable and financially friendly plan. Yeah.
Thank you, Dr. Tom. Question for Nat. Question from Rick Cho. Can a patient with a mild heart disease perform strength training in a gym and lift weights more than its own body weight?
Okay, so there are two parts, yeah? First part is strength training, and second is more aspirational. Can I lift more than my body weight? Okay, so Mr. Rick, thank you very much for your question. As any good doctor would, I will say check with your doctor. But this is general advice. Mild heart disease, I'm not sure exactly what you mean, but the guidelines are pretty clear that patients who have unstable heart disease or new onset chest pain, or patients who have very high lung pressures or previous tears in their blood arteries or have heart failure should not really be engaging in strength and resistance training. Okay, and also one more thing to watch out before you do strength and resistance training, please make sure the blood pressure is well controlled first, because when you do resistance training, the blood pressure is going to go up and it could go too high, and the consequences of that include stroke and tears in your big blood vessel called the aorta. So if you really wanted to do strength and resistance training, the American Heart Association's initial prescription is for you to go to the gym and lift weights in a rhythmic manner in moderate to slow speed with a full range of motion, alternating between upper and lower body. And important exercises that you would want to include would be things like chest press, shoulder press, triceps, biceps, lower back extension, and abdominal crunches, plus the lower leg exercises. Yeah. And they do recommend that when you first start, you should start with a single set, 2 days a week. Okay. There is no firm limit as to the weight, but I don't think anyone would be lifting through the full range of motion over and over again repetitively weight that is greater than their own body weight. So no, I don't think I would recommend that aspiration for the purposes of resistance training. Yeah.
Thank you, Dr. Koh. Wow, you really sound like a fitness consultant now. Everything is up here and you can tell so smoothly. Okay, next question to Prof. Tan, coming from Priscilla Chong. If my chest feels different or tight at times, but my pulse rate is normal, is this a symptom of heart problems, Prof. Tan?
Again, quite difficult just by one symptom to comment. Any chest symptoms, I think it should be evaluated. But from what you described, it sounds pretty atypical, particularly if it happens at rest rather than on exertion. And particularly if you're, for example, a young lady without much risk factors. So I think that most times if you are concerned, you should seek a medical consult. But I like to say that, especially during this period, we are seeing a lot of consults during COVID-19 for a lot of young folks coming to my clinic complaining of chest tightness, palpitations, everything, particularly related to the COVID-19 vaccine, and you find nothing wrong with them. And I think the mental health issue is quite troubling, I must say, at this period. A lot of people are experiencing stress, whether it's work from home, separation from family, isolation. So over and beyond that, if you do experience all this and you check out it's not a heart issue, you do need help, please reach out to a peer support group for those other mental stress issues. I think that's also quite common nowadays. Back to you, Sam.
Thank you, Prof. Tan. Next question for Dr. Tam. Question from PH Lee. Does intermittent fasting works?
So I presume it's to work. Does it work for weight loss? So actually, it's been shown to work, as you know, with many other diets. I think the term intermittent fasting unfortunately can mean a lot of things. So some people mean it's restricting the time that they eat, or we call it time restricted eating. Yeah, so that's one way. And some people, the real intermittent fasting is for like at least 2 days a week. It's not consecutive. People eat very, very little, literally fasting. That's why the word fasting, and it's done intermittently and not consecutively. So the studies have shown that it can work. And it works as well as even just restricting the calories on a normal basis, or the Mediterranean diet. Yeah. So whatever works for that person, but I would advise that if anybody has diabetes or any medical problems that need chronic medical, please check with your doctor, right? Because especially for diabetes, people go restrict, their sugars can drop, and hypoglycemia can mimic a heart attack, for example, and can have very serious consequences. So a healthy person, you can try on your own, but with people with problems, please check with your healthcare professionals.
Thank you, Dr. Tam. Question for Nat once again, coming from Priscilla Chong. Now, I think we mentioned about this, but just to enlighten us again, now that COVID is bad, how to keep heart healthy at home? It's hard to clock 10,000 steps, even if I do exercise. It's just not enough. So tell us a bit more, Nat.
Yeah, Ms. Priscilla, thank you for bringing this up again. I think it's important. Now, I would say that 10,000 used to be a way for us to quantify it. But I think as all of us on the panel have alluded to, we're looking at more, whatever you can do to not sit on your buttocks, okay? And get up and go. It's not the 10,000 steps. It's not being sedentary for 9 hours a day in front of a Zoom. Even if it means getting up to walk around your room, okay? We want you to try and get 150 minutes in, if possible, in the course of a week, broken up into bite-sized portions, whether it's 5 minutes on the one hand, 10 minutes another day, 30 minutes with your kids or family or friends on another. If you can get to 150 minutes of mask on, gentle outdoors, or even indoors, just strolling around, try your best. It's not possible all the time to hit 10,000. We have long tried to remove that barrier for a lot of patients by asking them to focus on, what we want to promote, which is reduction of sedentary time sitting down doing nothing. So even if it means getting up, pace your room a little bit, that little bit will help you as well. Yeah, so stay strong. It's really hard. You're not alone. I hope that you found some encouragement from each of us today.
Thank you, Nat. As Nat mentioned also, once again, just keep moving. So you can do a lot of housework if you want, do some gardening. Sometimes you have a big garden, right?
And squatting as well, actually. Squats, very helpful for balance and resistance training and no cost. I do squats.
Fantastic. Okay, next question to Prof. Tan from Lily Tan. I have family history of diabetes. Can I do HbA1c test every 3 to 6 months?
So you're referring to getting a diagnosis of whether you'll get diabetes as well? This question I'll probably defer to Dr. Tam, but in general, no. Please don't do HbA1c every 3 to 6 months if you do not have diabetes. HbA1c is something we do usually to monitor the control for diabetes. We can use it to diagnose diabetes, but I don't think there's a need for you to check it every 3 to 6 months. But if you are concerned, just watch out for the rest of the predisposing factors for diabetes. I would advise you to do a glucose tolerance test perhaps, and maybe at best once a year random glucose just to monitor that. But this question may be better answered by Dr. Tam.
I'll just contribute my 2 cents worth. So I think HbA1c in Asians are not very validated for diagnosis. If it's very high, it's a clear cut. But the borderline cases, unfortunately, we don't have enough to say you have or not. So like Dr. Jack has mentioned, the fasting sugar, and if needed, then the glucose challenge test, glucose tolerance test is helpful. And definitely with a family history, that's genes, the weight plays a very, very big part. Again, that's to be kept in check. Yeah.
Question for Prof. Tan, since we're at it as well. Now, question from Pate. Having WFH increases my weight issues. How do I cope with it?
Well, thanks, Pate. That's a very challenging question. So I think every one of us is different. I think firstly, I would encourage maybe you to just take a look back at what doing the work from home thing could have contributed to the weight gain. It could be your really cutting down on your activity for a start, and then also maybe the pattern, eating habits, because some of us are stressed from just can contact the boss, can see the boss more often now, or everybody contacting you through Zoom and all that. So that can also trigger, stimulate us to eat more, snack more, or bored. And now the kitchen is just like that, right? So we can just reach out for food. So I think first and foremost, we have also some resources on a website that we can share with you later to help you with some tips. I would say have a structure. it can't be the same structure that you have when you're back at work, but do have a routine. I think a lot of people, that routine one is broken. Your body also will sense the routine, and then they will send signals to make us haywire, right? Where sleep are included and stress. So I think those things are very important to have a detective, right? Check through your routine and then see where the triggers are. Make sure you sleep enough, keep that routine, and have an eating plan, right? Sometimes it could convert to like now work from home. I sometimes have to eat just twice a day just to keep my weight in check because I don't move around that much, right? Or as much as I want to, right? So sometimes it means adjusting some of that on certain days. So I think if you really need the help, reach out to the resources we have or to the experts on the panel, and we can help you further. Yeah.
Thank you, Dr. Tam. Now, question to Prof. Tan from Edward Lim. Is medication necessary for obesity, heart disease, and diabetics?
So I will say, before I talk about medication, which is everyone's favorite ask, all these things you mentioned need a lot of lifestyle interventions, firstly, for weight control, for stress reduction, exercise. But unfortunately, a lot of times established heart diseases, hypertension, diabetes, do need medication to control it, to nudge you in the right direction. And compliance with it is also equally important. So I would say, for a small percentage of folks, if you do change your lifestyle drastically, cut down all the carbohydrates, go to a plant-based diet, live in the mountain and walk up every day, up and down, maybe there's a chance you'll do without medication. But for the majority of the folks, I think medication will be necessary. Thanks.
Thank you. Question to Natalie from Jeffrey Toe. How to exercise safely? There are many cases of healthy people who seem to be so healthy, but also have a heart attack or cardiac arrest while working out. What are the ways or how you can exercise without getting all these attacks?
So, Mr. Toe, I think, or Mr. Jeffrey, actually, when it comes to sudden deaths, and we see that in the news, it isn't always because of a heart attack per se. Okay, it's in younger people, it could be due to genetic conditions. It could be due to, the sudden death could be due to incidents outside the heart. Okay, so but having said that, these are symptoms you need to watch out for and withhold further activity and see a doctor early if you do have. Okay, and these symptoms are, if you were to have chest tightness here in the middle of the chest especially, okay, that is of new onset, worse when you exercise and gets better when you stop that exercise and 10 minutes later you feel better. It need not always be pain. It could be a heavy sensation on your chest. It could be more breathlessness than normal, very subtle. If you have these kind of symptoms, please do not persist with exercise because you very well could have a blocked blood vessel and you should see a doctor before proceeding with more rigorous activity. So it's very difficult to predict, and that's why it's called sudden, but you can educate yourself on the symptoms to watch out for, the 3 that I mentioned, and avoid physical activity if you do have it and seek help early.
Thank you, Dr. Koh. Now, next question to Prof. Tam, coming from Amrita Roy. How much calories intake should be there for a healthy diet?
So for a healthy diet, okay, so I think the HPV says about 1,008 for women and 2,002 for men. So in general, I would say about anywhere from, depends on where we stand, at what weight we're at, about 1,002 to 1,008 for women, and anywhere from 1,005 to maybe 2,002 for men, depending on how tall we are and the weight that we're supposed to be at in general. So actually, there are calculators that you can use. Right? A very quick guide we use is like 25 times your weight is roughly kilocalories, is about how much you need a day. Yeah, but if you're very overweight or obese and you want to reach a certain weight, don't suddenly like jump to that. Yeah, so I think there are calculators online, and Health Promotion Board also has that to calculate, or things like MyFitnessPal, which has the Asian, more Asian focused type calculators for your caloric intake a day. Yep.
Thank you, Dr. Tam. Well, ladies and gentlemen, we have the final question right now, folks, because we have more resources to let you know. But we thank you guys for all the questions coming in. We may not be able to answer all, but we'll do our best. So let's go for the final question to Prof. Tan, coming from Gabriel Chia. What does low level hemoglobin or blood count in blood check screening indicate? Low level of hemoglobin, what does it mean?
Basically, hemoglobin is the red blood cell count in your body. So it means you're anemic. So you do have to look out for the causes of that. In most cases, if you're not thalassaemic or you don't have a genetic reason to have low blood count, iron deficiency is the most common in folks, either nutritional or blood loss. So you do have to find out more the cause of the anemia. Most times, I presume you're not symptomatic, you were just picked up on screening, and you have to investigate whether it's iron deficiency or other causes and find out the cause. I think the cause of the anemia is important to elucidate, because sometimes it could be a GI loss from occult malignancy, or maybe it's a bleeding pulse, for example. So again, low hemoglobin just means that you have low blood counts, low red blood cell counts, a condition called anemia. Do ask your doctor to get you appropriately assessed. Thank you very much, Sam.
Thank you very much. So eat red meat, as you might. I presume you might recommend eating more red meat or taking more red wine. Are they good for the heart?
No, find out the cause first before you jump to eating more red meat. Yeah, thanks.
Okay, there you go. So we hope that answers the question, folks. So don't forget, folks, any question you have, don't worry, because right now we can get the speakers to elaborate more about the resources where you can find. And of course, if any questions, you can go to these resources. So Dr. Tam, can you tell us a bit more about www.weightcanwait.sg? Tell us a bit more about this site. What can we learn from this site?
Sure, thank you. So it is actually a website that you can find more resources on. Firstly, the different interventions or methods you can lose weight, and also the resources like where to seek help in Singapore. And again, these are trained professionals. They could be your primary care doctors, your GPs, or they could be the restructured hospitals that have teams that Dr. Jack Tan had referred to. And we even have a BMI calculator on there as well.
Thank you. So don't forget, folks, the website is www.weightcanwait.sg. Okay, so there you go. These are some of the resources you can find. Now, to Dr. Koh, tell us a bit more about NHCS. What is it actually?
Very proud to be part of the National Heart Center in Singapore. So this is all you need to Google. NHCS Patient Education. And it will lead you straight to a page full of information that has been carefully curated by the Patient Education Committee in the National Heart Center. They put in a lot of hours. They aggregate input from multiple experts to distill the best of heart health information that they can for you.
Thank you very much, Dr. Koh. Now, ladies and gentlemen, to find out more about information about My Heart, well, Prof. Tan, please elaborate more about the Singapore Heart Foundation website, www.myheart.org.sg, or our Facebook Heart Foundation. Tell us a bit more.
Actually, a lot of people don't access these resources that is very openly available for the Singapore Heart Foundation. So the Singapore Heart Foundation is a charity organization that caters to heart health. And there's a lot of information and programs on the website that you can access. So it allows you to actually check out information on your heart health in terms of diagnosis, in terms of how to do healthy eating habits, healthy living habits. For diabetic, for how to calculate your BMI, for example, how to get the appropriate exercise, heart rate calculator, how to do smoking cessation, stress management, weight management. And there are a lot of courses for you to sign up in order to learn how to do CPR, for example, how to use the AED that Heart Foundation is providing in all the housing estates. And also just to tell you about what Heart Foundation is about in terms of our community engagement, education, our AED initiative. And also a chance for you guys to join the Singapore Heart Foundation as one of our heart health volunteers as well. We have a lot of support groups. We have also a lot of on-site rehab facilities. So for example, you are a heart attack survivor, please welcome to join our physical rehab programs, outpatient, very affordable, in fact, very, very low cost, and some of them free of cost to the public. So please go onto our website, our Facebook pages, all the resources are there. And as a charity organization, we're very proud to bring this back to the community at all levels. So thank you very much, Samson.
Thank you, Prof. Tan. And also, folks, don't forget YouTube channel as well. We have our very own YouTube channel with all the resources, the programs, AED, CPR, obesity, COVID-19 prevention, and so much more. Okay, so don't discount that as well. Facebook page, our website, and also our YouTube channel. Okay, so lastly, folks, before we end our program, I'd like to ask all our three panelists to contribute at least one takeaway point, for all our viewers here. We'll begin with Prof. Tan first to give us one action or one takeaway before you go.
So I think what we're talking about today is prevention. So I think if you are above the ages of 40 or preferably about 60, do go for your annual health checks. I think picking up the disease early, treating it early is what will prevent a lot of pain and later on. So yearly health checks as advice from me. And again, COVID-19 vaccination, please. Yeah, thank you.
Okay, so early checkup, huh? All right, early checkup and get your vaccination. It will help you. Now, next, Dr. Tam, tell us a bit more. What should you tell your friends right here, all our viewers?
So one thing I think exercise, diet, everybody knows that. So the campaign that we run, which is the website, is Your Weight Can't Wait. So if you really feel you have an issue or your family has an issue, please don't wait. Again, early intervention is better. And then we also have 3 S's in terms of take care of your stress, take care of your sleep, and take care of your support, because that also affects a lot of your mental health issues.
Thank you. And I reserve the best for last, Dr. Koh. Please elaborate more and maybe give us a bit more motivation to those, people who want to change their lifestyle. Tell us a bit more. Give us one great tip that we all can remember.
It's so hard coming last. I just have this to say: you are not alone. Okay, you are here in a room full of people with you, experts who care. We really believe in this movement. Your weight can't wait. Your heart health is important. You are not alone. The fact that you are here shows that you are ready to be empowered. Take this good advice, start Googling, start moving, and get vaccinated.
Thank you, Dr. Koh. Well, ladies and gentlemen, a big thank you to all our panel of experts and our viewers for joining us today. Now, we hope you have learned more about obesity, diabetes, and heart diseases in our session today. Now, also with support from Novo Nordisk, SHF has also organized a campaign contest for a chance to win up to $50 NTUC Fair Price vouchers. So follow the link provided in the YouTube chat box. And also, SHF has also been organizing her annual National Heart Week World Heart Day 2021 virtual in September. And there'll be exciting giveaways and interactive activities lined up. So keep out a lookout for announcements on our social media and website. And finally, folks, for more heart health information, visit our website at myheart.org.sg or Facebook page at facebook.com/heartfoundation. So with that, ladies and gentlemen, thank you so much. Ladies and gentlemen, thank you so much for joining us. Thank you to all our speakers. Let's say goodbye to all our fans and viewers. Thank you for seeing everybody online across the globe too as well. So thank you so much. With that, ladies and gentlemen, thank you and have a great day ahead. Thank you so much.
Okay, great. Thanks a lot, Sam. Great hosting.
Thank you, Sam. Thank you, Dr. Jack. Thank you, Dr. Tam.
Bye-bye.
Thank you. Good night, Nat.